Hi there. Welcome to The Preventable, the podcast giving you a seat at the table with conversations about the intersection of alcohol, drugs, and mental health in everyday lives. Take a seat and join us.
Welcome to The Preventable. Before I introduce you to our guest today, I want to make sure and give a big thanks to Hubbard Radio for allowing us to come in their space, use their equipment, and record these great conversations for all of our listeners. Today, I'm very excited for our guest. It's a person who I've been connected with for many years, who I know believes strongly in prevention and public health. And so we always, when we have the chance to connect, have some great conversation. Welcome to the podcast, Dr. Echols.
Thank you for having me. It's a pleasure to be here.
I have known, and we've worked together for many years, and it's really true. I think from like day one, you were like speaking our love language around prevention and public health, and your work and your career has just continued to move in that path. So tell our listeners a little bit about who you are.
Wow. So I'm Dr. Fredrick Echols, and a lot of people in the St. Louis area know me from my time with the City of St. Louis Department of Health as Health Director. Before that, I was with St. Louis County as the Director of Communicable Disease Programs, as well as over emergency management for them. And then in Illinois, communicable disease, I covered communicable disease for the state. And then before that life, I was a military physician. So I did emergency medicine with the United States Navy, did a deployment in Afghanistan. And so it's kind of been in a lot of ways, a full circle moment for me now. Since I've left the city of St. Louis, my career has kind of taken different trajectories. One being more involved in violence prevention, so helping the violence prevention ecosystem adopt more comprehensive approaches to addressing the root issues related to violence in our communities, including counterterrorism. I was tapped by Department of Homeland Security headquarters a couple of years ago to actually help them implement public health approaches to addressing counterterrorism, and then some shifting happened last year, as we all know, and so right now I'm doing work with the Federal Emergency Management Agency, also known as FEMA, which is also under the DHS umbrella. And so one of my roles with them is overseeing all the readiness and training for all of their incident management assistance teams, which are the teams that arrive on the scene immediately after a disaster declared by the federal government.
Wow. So, and that could be like a storm disaster or...
Storm, tornado. That was the first group that came to St. Louis, was the IMAT, so the Incident Management Assistance Teams last year. Floods, wildfires, any disaster, they're responsible for providing that initial response. So they have a huge weight to lift. So obviously the readiness for all of the regional and national teams. So it's an exciting time.
That's a big job. That's a huge job. And I don't know, maybe this isn't true, but it seems to be that there's more natural disasters now, or like the weather, is it? I mean, I don't know. Or is it just because we're living right now and we're hearing about more tornadoes and more flooding, or are these things happening at a different kind of intensity than they once were? I don't know.
A little bit of both. So I think it depends on the year. So in 2024, there were a lot of declared disasters. In 2025, we had a very mild hurricane season, so there weren't as many disasters during that year. But what we're seeing is even if when there are fewer disasters, the devastation that comes with them is greater. And so what we've seen over the last 3 decades is the number of billion-dollar disasters has increased. And so that means, from everything from public assistance, so damaged infrastructure due to the disasters, individual assistance, so the families that are and the survivors who are impacted by the storms, make sure they have resources and they can get connected to federal and local resources to our programs. So there's a lot of funding that goes into response that individuals may not see.
Yeah. That's incredible when you start to think about the real impact and the ripple. And I know for folks in St. Louis who really experienced that with the tornado last year, and And although it was almost a year ago, I mean, it's still having the impact. And so we know that it's not just, oh, there was a disaster and we need to fix a building, but it impacts so much more than that. It impacts the individuals in that community, the entire community as people are displaced and some don't come back, the schools, the mental health and the public health infrastructure. It's definitely a huge kind of way that people and communities feel that when those things happen.
Absolutely. And then when we look at the state of the city prior to the disaster, in a lot of cases, the most vulnerable areas are hit. And so when you have...
And why is that? Why does that happen?
Well, we don't know, like, why a hurricane or a tornado or a natural disaster takes a certain path. But what we do know is that in a lot of cases, those areas that are hit, they've been neglected for a long period of time. So when we think about North City, the northern part of the city of St. Louis, there have been several opportunities where investments could have been made, but they weren't.
So then those structures might be more at risk, and the we'll call it the safety net of even other support there just doesn't exist. Okay. So it's not necessarily that, like, obviously a tornado or a hurricane doesn't say, oh, I'm going to hit this community, but it's really when it's hit, it just causes more damage in that way.
Right. And then we have to be mindful of the amount of damage the amount of pre-existing damage, because oftentimes we want to get reimbursed for the full amount. But then when we look at the assessor's records and we say, okay, this has been damaged for like 15, 20 years, like this.
That's, then you can't have all of that built back up in the same way.
And so while we're looking for the city and state governments to take a more, lead the initial response, we also have to be mindful of some of the limitations that they have as well. So a lot of times they have understaffed emergency management workforce. There could be a lack of knowledge around how to implement incident command structure, which is the standardized structure that we rely on to make sure that we have effective communication, and we also make sure that we're getting the right resources to the right places. And so if they're not able to implement the incident command structure as it's outlined, that creates other hurdles for not only the jurisdiction, but also for FEMA as we come in to provide support.
Yeah. Wow. So many layers there and so many things happening. And it's...
And one thing that I think it touches on when we look at the disasters and the aftermath, the amounts of mental health challenges that people have. And so, and we saw that in during the pandemic. So, we have this disaster, this pandemic, or have you, it's a public health issue. And it really makes the situation worse for folks. And people prior to these natural disasters didn't really have good coping mechanisms. Now you have all this added pressure.
You have exasperated stress and even if the mental health was not adequately being cared for or addressed prior to, now there's even a different kind of hierarchy or prioritization of needs here.
Absolutely.
If we're now looking at, well, now we don't have shelter or access to food or other injury, perhaps, mental health gets even pushed further down the priority list.
Right. And so then we see those individuals who are already vulnerable for a variety of reasons. You have the issue of substance use disorder, which I know that's at the heart of Prevent+Ed and working to figure out how we can connect with those individuals to prevent them from going down that path.
Right.
Because we know some folks recover. We know recovery is a lifelong journey, but some folks don't. And so how do we make sure that we're doing our very best to meet people where they are, but also connect them to resources they need in a way that is meaningful to them?
Right, and it's so important. And I know our agency, and we just did a small part, but we did what we could even in like the tornado recovery efforts in St. Louis, and going out and trying to connect with people in community, people that were still in neighborhoods to offer some basic needs stuff. We were there with some water and food and what we could, but also then some additional resources around substance use, both knowing that when there's increased stress, you might turn to that as a coping mechanism.
Right.
And or also it changes, again, the entire dynamic here of how people might have access to substances. And if we think about things like, of course, the opioid crisis, right? So even people who have been opioid users, we know that that drug supply can be very inconsistent at best.
Right.
And
Absolutely.
so now that people are displaced, they may be getting their supply from a different area. So re-educating and the importance of having things like naloxone available, because now if you were used to kind of in your body and you were used to a supply from a certain place, and now you're living somewhere else because your home no longer exists or your neighborhood doesn't, and now this might be a different substance. So kind of reinforcing those messages too, I think it's all part of the story that everyone doesn't think about and is not the headlines on the 5 o'clock news either.
Right, absolutely.
Yeah.
And one thing I have to give a plug for you all. So last year, there's a group of young men that we mentor, and these are individuals who are middle school age, high school age, and we were able to provide through Prevent+Ed, we were able to provide them with education on substance use disorder. So a lot of them, they hear about it in the streets, but they really don't have structured learning environments where they can really learn about what's happening in their community and ask questions, although they're exposed to it. So that creates a lot of different issues for our school systems and families. And so we were able to provide them with evidence-based information and then also train them on how to use Narcan.
You're right. It's so important.
Yeah.
And I'm glad you mentioned that, because I was going to say, I mean, the job in FEMA and natural disasters is a beast in itself, and then you still find time to come back to St. Louis and be in St. Louis and mentor young people. And that work, I mean, if it were my opinion, is even more important than the natural disaster work, because we know it's so important when we're talking about prevention for young people to have that caring adult in their life, to have those mentors. And I love following your work in that space too, and seeing and hearing about it. And I know what our annual Spring Awards luncheon last year, we really recognized you for that work. Thank you. And the Spring Awards luncheon is coming up again in April, and we'll be able to honor some more people. But it's so fun to be able to take those pieces of people's lives like yours, who, again, have all these like really cool like career experiences and history, but then get really excited about just the time you can do that mentoring. So how long have you been doing the work with these young people? I've
really been doing that since undergrad. So back when I was at Clark Atlanta University, one of the things that my mentor told me was you have to pay it forward. So it's not just about making it on your own, but who are you bringing along this journey with you? And are you setting up the world to be a better place when you leave? And so I have to think about that. And and also my work with the Obama Foundation. So being one of their inaugural cohort members, one of his priorities is making sure that we invest in the communities in a manner that helps us develop and nurture the leaders for the next generation. We see a lot of the issues with democracy as it stands today.
Right.
And so when we think about public health and all these other issues, we really need to make sure we're empowering young people to be able to make sound decisions and to be able to advocate for their communities when they get into the seats that we currently hold.
And it's just, it absolutely is the truth. I mean, what you just said is making sure that young people have that knowledge, have some skills, and just can see those opportunities.
Yeah.
And, for some young people, it's very hard for them to see,
Right.
or they think that even if they see it, they won't have the support to get to
Right.
something different than maybe what they've experienced so far in their lives. So people like you, and I know that, there's many others too, but we're talking about you today. So people like you that give that time, I think it's truly an investment and a valuable investment. What has been some of the more fun things you've got to do, or some of your favorite mentoring experiences?
So I think working with the Village has been a really great experience. So with the Village, we created this group of young men that we set aside as the Youth Executive Board. And so the goal there was to teach them about executive presence, teach them about Robert's Rules of Order so they can run a business meeting.
I should attend those. Sometimes I'm like, are we supposed to have a second on this? What's happening?
And that's what we say. So we wish we had this in high school and middle school so we didn't have to be on the steep part of the learning curve once we got into like executive level positions. And so seeing them navigate that in that space is really interesting to see how they think. And it's, even though I tell myself I'm not that far removed from that, I kind of am. Yeah. And so, but being able to help them navigate in those spaces, but also give them proper redirection. And so when they go off to college or wherever, again, they can function in a proficient manner versus, as I call it, winging it. They don't have to wing it all the time.
Right, that they'll know what they're getting into. Yeah, because I know, I mean, I'm sure you have had some experience in this too. Like I sit on several different boards, including my own board of directors, but then other boards. And I mean, there are a lot of adults sitting around the room that aren't well versed in things like Robert's Rule of Order or kind of some of that executive stuff. And to have those skills early can definitely be a big help to young people.
Yeah. So that's been really really exciting. And then outside of that, kind of spoiling my nephew and my godson. So they're both 7, but they're a handful. But they're brilliant. So my godson, he just turned 7 last week.
Okay.
And so I missed his birthday last year. And so he ended up getting me a rock for my birthday. So I have to go to California to pick up my rock. But just seeing them grow in this new environment and seeing how they have access to so much technology, but being able to help them utilize technology in a way that's meaningful. When AI was first introduced, a lot of families were against it because they weren't sure of the harms it could cause. And so being able to provide a safe environment for them to explore in this new space is really rewarding as well, because growing up we didn't have all of this.
No, and I think it really highlights young people today, and we have to be able to relate to them, and we can teach them things like old school Robert's Rules of Order, right? And but also we have to be able to accept that the technology, AI, and the way that they operate looks very different than the world used to be, and it doesn't mean that everything's bad. I mean, but teaching how to do these things in a healthy way, how to have some boundaries with the technology, what all that means. But again, it speaks to your leadership and your compassion here, that you recognize like figuring out how to connect with young people and how to make sure that you're not just this boring adult that's like, oh, you shouldn't do that. Back in my day, we didn't have that technology. So also being able to relate to them in that way, I think is again very powerful and important when we're helping to guide young people in today's world. Yeah,
and I think in along with improving access for young people, we're also having to do that for older people as well. Because one of the things that that I really paid really close attention to during the pandemic was the amount of illiteracy that we have amongst our adult population. And so, when we were issuing the executive orders, whether it's for them to stay at home and then the reopening orders, a lot of the individuals who are working in our service industry didn't understand what we were trying to communicate. And so we had to really work on simplifying our language so we can reach the masses, but also really try to engage the school systems, the education systems, to see how can we better support literacy. And I recall this one event where I went. Of course, I was shutting down some restaurants, but we won't call any names today. That we had to close down some restaurants because they weren't complying with the orders. And so I went in and but before they could reopen, I would go in and do the training. So they couldn't say they received a poor quality training, because since I said I'm coming. Started talking to the staff, and one of the staff pulled me to the side. He was like, they just pushed me through school. He didn't find out he was dyslexic until like he was in his mid-20s. Didn't really develop the arithmetic skills that he needed. But now he was charged with being the tutor or the trainee for his child who was at home. And so a lot of those issues were kind of overlooked. And so even when the schools reopened, I wish more thought had gone into better supporting the parents who may not have the skills to properly nurture their child in an academic setting.
And again, it's not just like the pandemic and those impacts only existed in 2020 through 2021, 2022. We're seeing that when I talk to my educator colleagues and friends who are, now the kindergarten COVID kids are getting ready to leave elementary school, and not all of them have had the same foundation as we might want or need them to have as they continue their education career. So we're still seeing that impact in today's world. Yeah,
and then the big question is what are school systems doing to mitigate that? We know that the education system is kind of in a chaotic state, if you will, at this point in time. But what will they be able to do to really save the next generation?
Well, I don't know if we have time to answer all those questions about how we're going to help insulate the world and save those generations. But I do know this. I do know it's people like you who see the big picture and see the importance of the large safety nets and the support of communities, but then also the importance of relationships.
Right, absolutely.
And the, some of those smaller, meaningful connections as well that will make the difference.
Absolutely.
And I'm hopeful that there's enough of people like you that do that, and that we will carry it through and be able to support each other. And that's what I believe that public health really is.
It is. It really is. And then I think also, everyone has a role to play. I think the way government often works is we say we have all the answers and we have all the resources and we give you what we think you want. But people in the community at the individual level all have roles to play, whether that's just talking about health issues within the home or if it's creating a balance so you can have a breather because work is stressful, life is stressful, creating a safe mental health space for themselves and their children if they have them is really important. So I think, but getting that message out to the masses is really important because I think some people feel like they have to be in a certain position to have an impact, but they don't.
They don't. No, everyone can do it.
Yeah. As I was talking to a church about 2 Sundays ago, we were talking about how we often refer to or reference individuals who've had these huge gains during months like Black History Month. It was like we can all create history in our own circle.
That's right.
Yeah.
That's right. I love it. Yeah. Well, thank you so much for joining me today. I know you are an incredibly busy man, and you have a lot of irons in the fire, a lot of things moving, and to give me 20 minutes, 30 minutes today is very grateful for it. So thank you so much, Dr. Echols. Thank you all for listening and for joining us at The Preventable. I hope you've liked what you've heard. If you want to hear more, please subscribe anywhere that you get your podcast. We'll see you next time.
Thanks for joining us at The Preventable, brought to you ad-free by Prevent+Ed. Prevent+Ed works to reduce or prevent the harms of alcohol and other drug use through education, intervention, and advocacy. Please visit their website at prevented.org. Like what you heard? Rate, review, and subscribe to stay up to date with what we are serving on The Preventable.